Hi everyone, thanks for tuning in. This little video explainer is going to shine a light on the importance of capturing the nursing process in the digital environment. We're going to spend a few minutes with the nurse looking after a patient. You'll get to see how the nurse imagines the nursing process in their head while they're providing care. It's a really common scenario, and you may recognize it from your own experiences as nurses, patients, or being a part of a digital project team. From time to time, a little thought bubble will pop up next to the drawings and will show you what the nurse is doing according to the nursing process that happens subconsciously. This nursing process is what needs to be captured in a health information system. In today's healthcare environment, this is really important to make sure each person's nursing care is safe and effective and just right for what they need at that moment and over the course of their hospital stay. All right, sit tight. Let's get started and meet Kate, our nurse, and Bob, our patient. It's a normal day and Nurse Kate has just started her shift on the ward. She's had her extra large flat white and she is ready for the day ahead.
Alrighty, Mr. Maxwell, let's get you showered. Would you like to go on the commode today, or are you feeling strong enough to walk?
Let's walk. I'm not going to use that chair with a hole in it. Call me Bob, can you?
Alrighty, can do, Bob. Up you hop. There you go. Look, and how are you feeling today, Bob? It's day 2, I think, after your emergency hernia repair surgery, isn't it?
Not too bad. It hurts, but I don't like them tablets. They make me sleepy and stupid.
Yeah, that's probably from the endone you've been having for pain relief. It can make you feel pretty drowsy. Can you tell me what your pain's like now, Bob? If 0 was no pain and 10 was the worst you could imagine, what number would you give your pain?
It's not too shabby. I guess about halfway. What's that? About 5.
Yeah, okay. And can you remember back to when you last took the endone? What kind of number do you think it was then?
Oh yeah, about 2.
Okay. But the 5 that you've got now, is that a manageable number for you? Can you take a deep breath for me?
Yeah, I can do that. I feel a bit of pain, but it's all right.
Okay. Alrighty, let's get this shower nice and warm. Bob, I'm noticing you're a bit wobbly on your feet. How do you feel about sitting down to shower?
Look, I'd rather not. I didn't get to be 95 not out by sitting down, you know. I'll be right.
Well, alright, Mr. Bradman. But if it's alright, I'll stay with you just in case. And can you just use the rail there to support yourself, please? I'm also noticing while you're showering there, Bob, your bum, your sacrum there, it's looking a bit red. It'd be good if we put some cream on it after showering. Have we been putting any cream on your skin at all?
Yeah, my ass is a bit sore, but no one's put any cream on that I know of.
Alright, well, we can do that. It'll also be really good if you can keep moving, so perhaps move around the ward, walk around using the handrails, maybe a few times a day while you're here. And when you're sitting in bed, shift your weight from one bum cheek to the other. You've got to get away from that really bony part on your bottom, and that'll help the blood flow better and your skin will be healthier.
Righto. Yeah, all this sitting around can't be all that good for you.
In this very small but important interaction, Nurse Kate followed the nursing process for Bob. Let's take a look at what happened in a bit more detail, starting with Bob's pain. Firstly, Nurse Kate evaluated the pain medication effectiveness that he's been given over the last few days by assessing Bob's pain. She then planned to reduce his pain medication and keep monitoring his pain. And finally, she provided an intervention by educating Bob about his pain, the medication, and the side effects. It's important to note that there's no point in giving Bob pain relief if we don't then make sure the side effects weren't worse than the pain. This would only be doing part of the nursing process. But you can see that nurses are often multitasking. They do so about 50% of their time. Nurses do not and will not work in linear ways. They multitask and are often interrupted. For example, they may be educating their patient while they're walking them to the toilet. And they may be assessing their patient's pain while they're helping them in the shower. So you get the picture. Nurses multitask all the time. We want this nursing process to be a loop, but it's not always a loop. It's often different nurses on different shifts, multitasking, and being interrupted.
Oh, by the way, nurse, I haven't had a crap for a week. I don't think that can be right, can it?
Yeah, no, that's no good. The endone can make you constipated. Let's see what we can do about that for you.
Ta.
That's why it's really important to capture the information however it arrives. Deciding which elements of care to collect and how the elements will function as data is important. This requires a careful balance between nurses being able to document all the aspects of the care and actually doing the care. Prompts and reminders that help close the loop of care can be more helpful than tick boxes or lots of empty text boxes. The nurse and healthcare organizations are responsible for using the nursing process. We don't want nurses to feel like they're drowning in paperwork or filling in computer fields that don't make sense to the multitasking and interrupted flow of patient care, or talking more to their computers than they are to their patients. We hope this example of a common nursing process helps you and your team to design effective health information systems and deliver comprehensive and quality nursing care that suits the needs of individual patients, like Bob.
You beauty, Tar.
If you want more information, stay tuned now and watch each different patient care plan appear based on the story you heard earlier with Nurse Kate and patient Bob. To help us do this, in this final stage of our animation, we'll describe the nursing process Nurse Kate is doing for each nursing care plan. The 4 main actions of the nursing process are assessing, planning, interventions, and evaluation. It might help you to know that in Australia, we tend to refer to each area of patient care needs, like pain or skin care, as a nursing care plan. But in the US or other places that use standardized nursing language, they more often call them nursing diagnoses or nursing problems. Here's some examples of standardized nursing language. All right, let's go. Let's take a look at the remaining patient care plans. Do you remember when Bob's skin care was discussed in the shower? Nurse Kate assessed Bob's skin integrity. Then she planned an intervention for promoting skin integrity by using the cream. She also intervened by providing Bob with some education about moving around to increase circulation of blood to the skin. And she also closes the loop by evaluating the current skincare provision, checking whether other nurses have used any cream yet. Let's now quickly take a look at mobilization. Next up, let's briefly review patient preference. Nurse Kate also thought about risk management. Let's see what happened. Finally, the important area of hygiene. Even the most basic care needs to be a part of the nursing care plan. Research shows us that fundamental care like hygiene is the care that's most often missed or rationed in hospitals because nurses have to prioritize life-threatening issues and treatments. Now you have seen the nursing process in action in relation to a tiny 2-minute patient interaction with Bob in hospital. We hope this story and graphics will help you and your digital project team to decide how to capture and integrate important aspects of nursing care in your digital health projects. Closing the loop of the nursing process in digital systems will help Bob achieve safe and effective care with his nurses, care that's just right for his needs at that moment and over the course of his hospital stay.
That's great. Awesome. Thank you.